This is a picture somewhere near the rest position, that we see this very large space. When you take a look here, this is his centric relation position or centric occlusion. What that means is his jaw's been manipulated using a deprogrammer and closed into initial tooth contact, which unfortunately for us is somewhere way back in the posterior. Now, it's not a huge discrepancy, but there is an MI to centric occlusion discrepancy. And if I intend to wax this and design this, I want to do that in CR. Now, when I keep his jaw in a position that allows me to open him slowly without allowing the mandible to translate, we'll see some interesting changes. Now, when we measure the Shimbashi measurement, which is CEJ to CEJ, on this individual, we quickly come to the realization that he's nowhere near that 17 to 18 millimeters. And in fact, if I were to open him to 17 to 18 millimeters, which this is, we have to recognize that this is opened past his physiologic rest position. I'm going to have to find a vertical position somewhere between these two spots to restore him. Let's talk about injection molding. So here's that maxillary diagnostic wax set on the left. And on the right, what you see is a clear matrices. But what I want to draw your attention to is that the matrices have a small hole that has been drilled through the incisal edge of each of the 6 anterior teeth. And that will allow me to injection mold. So the plan for this patient was to begin with the upper arch, but I wanted to do it in a very segmented fashion. So I used injection molding to do that. So in the first phase, the patient comes in, we've got our approved wax up, we've got our shapes ready to go, and we use GC's Exiclear. Now, it's important to recognize that this is actually officially a bite registration material. With that said, it's a silicone, and I use it for impressions all the time. Now, the first time you do this, I want you to recognize that as a bite registration material, it's going to set quicker than a conventional impression. This is a beautiful composite resin designed exactly for the technique we need. It comes in 16 shades, and it works brilliantly for this technique. So this is something I've used with all injection molding. It has very high flexural strength, very good wear characteristics, and has lots of shade. A couple things I want you to notice when we change the vertical dimension. Number one, does he look younger? Yes or no? That's really an arbitrary question. Number two, does his face appear narrower or wider? And number three, what's happened to his gummy smile? Have we decreased it? Now, my clinical observations are this, that when you restore a case from left here to right, and you're using these beautiful restorations and doing the very best you're capable of, you will change the patient's appearance. So there's the before and the after of the upper arch. We've got him restored. And what do I notice? The first thing I notice, he's got a bigger smile. He's smiling more. He's happier. You can see it in his eyes. Number two, I think he looks younger. Number three, to me, he looks narrower. He looks like he's got a narrower, taller face. So I think mission accomplished.